All right, it's Kevin Begley, another Star 99.9 podcast. With me today, my guest is Dr. Weiss from CT-ENT in Stamford and Norwalk, ct-ent.com. And I have a lot of questions about allergies.
Okay. I hope I have a lot of answers.
Right. So I think like a lot of people, I've suffered from allergies my whole life, seasonal allergies for the most part. And I think a lot of people are the same way with that constant, I sort of get those sinus infections a lot.
Right.
So are there any relief options available for people who get a lot of sinus infections or things like that?
Well, I mean, it always starts at home, right? So you want to, well, first of all, we'll break it up. So if we're talking about allergies, it's good to have an idea of what you're allergic to. So you can mitigate. So if it's something in your home like dust or mold or perhaps a pet, you can maybe take measures to avoid exposure. The best way to know what you're allergic to is to get allergy tested, which is a service we provide, and there's many places you can get allergy tested, obviously, just to find out what you're allergic to. You can follow pollen counts online so you know what season is coming up when you perhaps may have a bad exposure to the things you're allergic to. So for allergies, the first step is always avoidance if you can avoid it. The next step is home remedies. Saltwater irrigations, and this goes for sinus problems too, are the way to go. And it really doesn't matter what brand you use. The point is you want to use saline to wash out your nose a couple of times a day during a bad cold or during a bad allergy season can really help make a difference. In the wintertime, you really want to humidify your sleeping area because the heat is on. It dries out your nasal passages. Nasal passages need to be moist in order to work properly, to get that drainage, to get that, that cilia, to move all the particles out and move all the stuff out. So if the mucus gets too caked up, too thick, it's going to have a hard time doing it. So humidification is really important, especially now in the wintertime when things are heating up in your bedroom. So those are some main things. Over-the-counter medications, there's a lot of great over-the-counter medications for allergies. There's decongestants, which you'd have to check with your primary doctor because there could be some side effects with those. Antihistamines as well. Just because it's over-the-counter doesn't always mean that it's safe for you to use. There could be a drug interaction. There could be, just if you have a certain medical problem, especially let's say in older men with a prostate issue, we steer them away from antihistamines, just to give you an example. There's nasal steroid sprays, which are over the counter as well and can be quite effective. Again, you always want to check with your primary doctor.
Yeah. Because that's, you were talking earlier about, I think a lot of people think of the springtime for allergies, but
right.
It can affect you all year round. I mean, you were saying about dryness. I wake up all the time with that dryness.
Yeah. We're actually really busy right now with allergy patients, believe it or not, because in the wintertime, especially now with everyone being indoors so much, if you have an allergy source in your home, such as dust, mold, or pets, you're really exposed to it in the wintertime because you're just kind of shut in with it. Yeah. So it's a myth that allergies are only in the spring and fall. Right. We see them year round, and we're actually pretty busy right now seeing allergy patients, as well as our sinus patients, in addition to that.
And you were talking about some over-the-counter type stuff. The allergy drops, do those work, or can those cure allergies, or are those?
Yes. So, I mean, it's a great question. So, just so there's no confusion, allergy drops are not available over the counter. They are considered a prescription in the sense that you have to go to a practice that would prescribe allergy drops. And so for example, we use a compound pharmacy that's a specialty pharmacy just for allergy drops, and they're located in the Midwest. So basically, once we do our testing on our patients, we have sort of the recipe, the prescription for what components need to go into those allergy drops. And the way allergy drops work, and it's the same principle as allergy shots, and some of your audience may be more familiar with allergy shots because those have been around for a long time. With allergy drops, you're introducing all the things you're allergic to. based on your testing. So which trees, which molds, which ragweed, there could be 20 ingredients that go into your allergy drops. And if you introduce those ingredients over time, and we're talking months to years in small amounts, it kind of tricks the immune system into not reacting to it anymore. It basically desensitizes the immune system so that when you get exposed to the natural ragweed out in the nature, for example, your body's not going to react to it. You're not going to get allergy symptoms. So allergy drops and allergy shots are considered immunotherapy, which is a cure for allergies. It's really the only cure that's out there. And we have patients that are doing allergy drops, and they've actually kind of graduated. They've done them for anywhere between 3 and 5 years, and they stopped doing them. But they maintain that desensitized state. And, depending on which source you look at, that's desensitized state can last 8, 10, 12 years, where you're kind of like allergy free, not needing medication, or big reduction in medication and symptoms.
Yeah. Now, another thing I've been hearing a lot about for people who have sinus problems is the balloon sinoplasty.
Right.
So go into that a little bit. Explain what that entails. Yeah.
Sure. So it's a big part of what we do here at CTENT. Patients that are at the point where they either are getting too many sinus infections, too frequently, too often, too debilitating, affects their job, affects their productivity, their just sense of well-being, or patients that have chronic infections that don't go away. And we're talking about, once we've treated them medically, we've addressed their allergies, we've done all the medical things that can be done, we will offer, if appropriate, a balloon sinus. It's all either called balloon sinuplasty or balloon sinus dilation. It's really the same thing, just different descriptors. And what this does is, this is a procedure that we do in an office setting. It's done under local. In many cases, the procedure part of it, not the preparation part, takes only 10 or 15 minutes to do. Wow. And basically what it does, without being able to show you like a video, imagine a little balloon catheter. So it's a little catheter with an expandable balloon on the end of it. And we're able to place it right into the opening of the sinus, which is usually very narrowed or blocked. So picture the sinus like a funnel, and then the narrow part is either too narrowed or it's blocked. But once we put the balloon inside of it and we expand it, it forces the walls apart of that funnel. Because really what those walls are made of is almost like it's thin as an eggshell, the construction of those walls. So it doesn't take a lot of force to push them apart, and then they stay in that position, and then they heal in that position. So this is considered a permanent fix for that sinus that keeps getting blocked up. Patients that get recurrent infections, they get those sinus headaches, between the eyes or in the forehead. Very typical symptoms. And this can be literally a cure for this, because it just changes the whole way the sinus is able to drain and fight infection and prevent it from getting infected and blocked up in the first place.
Yeah, that would be a big relief for a lot of people. And after that procedure, how long before somebody's able to go back to the office or to exercise or things like that?
Yeah, so this is what's so great about it. This technology, it's been around since probably the mid 2000s. We started doing it in 2010, and have had a great experience with it. It's really kind of a game changer for what we do, because prior to this technology, the only way you could fix someone's sinuses was to give them sinus surgery. And that entailed general anesthesia, sort of destructive moves to open up sinuses, packing in the nose, a much longer recovery. So this has replaced that for a lot of cases. And so what a typical patient would experience is, after the procedure, we usually recommend, anywhere from 24 to 48 hours of rest. So if you did it on a Wednesday, you could go back to work on Friday. Some people go back on Thursday, you know, but it's right in that range. It's usually not beyond that, because the pain levels are extremely low. There's no outward signs that you've had anything done. There's no swelling or bruising. There's no packing in your nose. So you're dealing with some post-procedure congestion for the most part, and that can take a few weeks to settle down. Full healing is probably in that 6 to 8 week range, but the downtime from doing this is relatively short. We encourage people to go back to their full activities within, 24 to 48 hours, including like if they want to go to the gym. Obviously, they're not going to do like our full workout the first weekend, but you can definitely move up to it.
But at least they're not out of commission for multiple weeks at a time, right?
Correct. Yeah. That's what's so great, because you're really not doing surgery. The catheter and the balloon are treating the sinus in a much different way. That's, very minimally invasive, and really no destructive process going on.
Yep. Great.
Like traditional surgery.
Yeah. Now, before I let you go, spring is right around the corner. So what can people do now on their own to sort of prepare for allergy season?
Yeah, so really good question. I'll go back to my first point. Know what your allergies are. And now you can do that through testing or just by your history. In other words, if you know every spring you're going to have problems, that means there's a high likelihood you're allergic to trees, because that's the first thing to bloom in the spring. And get familiar with the online pollen counts. You can download it on your cell phone, your smartphone, and just kind of pay attention to get familiar with the numbers, what's considered a high number, and know when, your allergens are going to be out and about. And you can even start to pre-treat. So if you know you're going to get allergy symptoms at a certain point in the year or a certain season, you can start your nasal steroid spray a couple of weeks before you're actually symptomatic. Some people would even start taking their antihistamines at that point. There's also a strategy to use allergy drops on a seasonal basis or pre-season. So for those folks that, where it's appropriate to do allergy drops, we have patients where we would do that as well. So there's some preemptive things you can do. I think the most important thing is paying attention to your symptoms, trying to correlate with the allergy and the pollen counts, so you kind of know what to expect, and you can pre-treat to some degree.
Great. Thank you so much for doing this for us, Dr. Weiss.
Hey, it's my pleasure, Kevin. Thank you so much.
I know a lot of people have questions, so this hopefully answers a lot of things for people.
And we're always up for questions as well. If people have questions, they want to contact us. Yep. We're happy to be a resource.
Yeah, ct-ent.com, and you can also visit the Stamford and Norwalk locations and reach out to Dr. Weiss. And once again, thank you so much.
Oh, thank you, Kevin.